Welcome back uh, to our sessions. Hopefully you guys enjoyed your break. Um, so we're just finishing off unit CHCMHS007, work effectively in trauma-informed care. Like all the other sessions, I've already done a pre-recording of the main learning outcomes for this session. That will be sent out to you guys hopefully by tomorrow. So you get two recordings. One will be the pre-recording and the other one would be the recording of this session. And in that email, you'll also get attachments of other videos on YouTube that will just there to further enhance your understanding of this topic in hand. All right. So before we start, I just want to acknowledge the traditional owners of the land. So in the spirit of reconciliation, Hattah Institute of Education acknowledges the traditional custodians of country throughout Australia and their connection to land, sea and community. We recognise Australia and Torres Strait Islander people as the first inhabitants of the nation and the traditional custodians of the land on which we work, live and study. We express our gratitude for the sharing of this land, our sorrows for the personal, spiritual and cultural costs of that sharing, and hope that we may move forward together in harmony and in the spirit of healing. We pay our respects to all First Nations people and acknowledge elders past, present and emerging. Okay, so today's session we'll be looking at referrals and document resources. And
You know, if you guys starting to find your brother now, he's going to look over your place, man.
the elements, as you can see on the screen there. So we'll begin by exploring trauma barriers, understanding how past experiences can shape behavior and access to services. Then we'll look at anger management, where we'll discuss strategies for supporting individuals in regulating emotions more effectively. From there, we'll look into crisis management, so examining techniques to handle immediate and high pressure situations while ensuring safety and resolution. We'll also address detrimental practices, so recognizing harmful approaches that could unintentionally impact outcomes negatively and how to avoid them. Self-care will be another key focus if we have time. If not, that's covered in the pre-recording as well, as it's crucial for maintaining personal well-being while supporting other people in our care. Finally, if we have time, we'll look at some case studies where you guys will answer some questions as a group and applying what we've learned to real life scenarios, just to further strengthen our understanding and practical application of these concepts. So just before we start this slide, again, there's a pre-recording, and then you got the live sessions. During the live sessions, the first half, I try to cover as much of the content as I can. And in the second half of the session, I cover the assessments. And then right in the end of the session, half an hour, I will play a video of a role play or some other key videos that are relevant to this unit. So trauma-informed care, we've covered this in the first two sessions before the break. So just as a reminder, it's a framework that is very important in supporting individuals who have experienced trauma. So it begins with understanding the profound effects trauma can have on an individual's behavior and their mental health. So this approach emphasizes creating a safe and supporting environment that focuses and fosters healing and recovery as well. So the 5 core principles that guide trauma-informed care, as you can see on your screen, is safety, trustworthiness, peer support, collaboration, empowerment. So when it comes to safety, this is about ensuring that clients feel physically and emotionally secure in their interactions with yourself. Trustworthiness, so being transparent and consistent to establish a foundation of trust. When it comes to peer support, it's about leveraging shared experience to promote understanding and also recovery. Collaboration, so this is all about working together with the client, which involves clients in the decision making and valuing their inputs in the care plan or case plans. And empowerment, this is where we support clients to build confidence and take control of their recovery journey. So these principles work together to hopefully minimize re-traumatization and ensure that care is respectful, supportive, and tailored to the needs of each individual. So just a warm-up question for everyone, if anyone wants to chime in. How would you prioritize these principles in your practice, and which one do you think do you find most impactful for clients recovering from trauma? Kiba?
With trauma-informed care and the not re-traumatizing them, it's always best. It may happen anyway, given the nature of the nature of what you might talk about, but you might put some safety plans in place, like give them some stim toys to have so they've got something to play with, or use the traffic light system, like red for we need to stop this conversation, yellow for I'm becoming uneasy, and green being all right. Just coming up with strategies to work with the client to not necessarily prevent, because it will happen, but to try and negate and minimize the harm that re-traumatization would cause.
Yeah, excellent. And that's a great example of empowerment as well, and giving power to the client, taking control, some sort of control during the sessions as well. Very good. Thank you for that. Anyone else? Alona?
Some of the questions as well, that as much as possible, I'm trying to avoid that might be triggering, because sometimes while talking about it's now that it's like it's flashing back, it's really like it's still like it's like raw. So I think that's a good as well, that like Kiba said, strategy and some questions that might need a better more sensitivity.
Excellent. Yeah. And that's a great example of safety. So taking precautionary steps in watching your language and being mindful of the triggers for the client as well. That's a very good example. Thank you. All right, let's go on to the next slide. So recognizing trauma barriers. So here we'll look at or focus on recognizing trauma barriers. Trauma can present in many ways, but some common examples include on your screen. One is emotional intensity, such as feelings of anger, depression, or anxiety. So these can be overwhelming for individuals and may impact their ability to engage effectively. Another one is learnt helplessness. So this is where individuals feel they have no control over their situation due to their past experiences. Flashbacks, which are sudden and vivid memories of traumatic events that may disrupt their current state. And then finally there is cultural and language barriers. So this can prevent individuals from expressing themselves fully or accessing the help that they require. So these barriers are significant and require us to approach support with empathy, patience, and understanding. Kiba?
Something really important to realize when talking about flashbacks, something very important to realize when you work with someone who's got extensive trauma, particularly complex post-traumatic stress, you need to realize that sometimes they won't realize what their triggers are. You can do all this planning and you can still accidentally trigger a flashback. And that can cause a number of different reactions from the client. So it's very important to recognize that some behaviors from the client, that obviously there's no tolerance, but understanding from a place of this person is reacting to the fact that they've had a trauma occur, and it may be their first flashback. They may have no idea what's going on, so they're likely to be absolutely terrified. And so the best way is figuring out what works for them to bring them back to reality from having a flashback, and moving forward with, okay, cool, that's a trigger. Let's not go near that until you're ready.
Excellent. Which comes to my question. What strategies can you use to overcome barriers? And you just gave a good example of one for flashbacks. Can anyone provide any more examples of strategies that we can utilize to overcome barriers like learned helplessness or cultural differences when supporting someone with trauma? All right. So strategies to overcome these barriers could include, Kiba, did you want to share one more?
Yeah, strategies for overcoming particularly learned helplessness is encouraging not doing things for the client, because they fall into a pattern of, I don't know if this is learned helplessness, but they rely on others too much. They become incapable of making their own choices without external input. It's important to encourage encourage independence and encourage them to make their own decision on what they've got as options. Because sometimes, okay, these are your options. Let's go from here. This is your choice.
Yeah, excellent. So one of the core principles of trauma-informed care is empowerment, and a big part of empowerment is allowing the client to make their own decisions and take their own journey when that comes to their decision making and where they are going in life. And like you said, this builds their skills around independent living as well. Lona?
Because like say for person from a different culture anyway, because become like coming like here in Australia, like become like codependent. So it's more relying with the other person, but then like because isolation, and when being trust with this person but being with the victim of betrayal, and thinking like to ask for an assistance, how could I trust these people because the person that I'm more relying with betrayed me. So that's why it's sometimes encouragement. I think it really need to work hard. And I mean, it's sometimes like saying like it's a baby steps, like it needs to have a fair go. And then because along the way, sometimes it doesn't work with the expectation. So it's still always like taking the risk.
Yeah. So so what I understood from what you were saying is that the way you build trust with clients is to be consistent with your approach
Yep.
and to build that trust over time.
And
Excellent.
authenticity as well. Authenticity too.
Yeah, exactly. Thank you. Edward?
Something that we've brought up before. Wait, can you hear me?
Yeah, yep.
Okay. Something that we've brought up before in multiple past lessons is making the client aware of the exact thing that you will be talking about during the session. And what it does, it allows them to properly manage their own mental state and prepare for what you are going to ask for. And I think that obviously, that will be that may occur and happen, but in general, giving them that understanding of like, okay, this is the strategies I'm going to be going over. This is what I want to be. This is what I'm going to try and talk to you about, or just making it aware to them of what you're exactly going to be talking about.
Yeah, definitely. So you don't want to surprise the client and cause any
Yeah.
more stress than they've already gone through.
Yeah. And
Yeah.
I think another thing is being extremely patient, letting them understand, listen, we will take this at the pace that you want to go. not the pace that anyone around you or anyone in this facility wants to go, but the pace that you wish to go. And it allows them to have that sense of control of, all right, this person, they're giving me the opportunity to go and speak about the things that I want to at my own rate.
Yeah, definitely. Kiba?
Just adding on to what Edward said, it's also good to, like, letting them know beforehand is also really good for if they're not up for that conversation. They may not be ready for that conversation, or they may have had something happen to them on the way, or they might have had a bad week since you spoke to them. So it's also really important as well, I do agree, because it just gives them that chance, if they really can't handle it, to let you know in advance so that we don't step on toes by accident.
Yeah, perfect. All right. All right. Strategies for emotional regulation. All right. So let's look over some strategies for emotional regulation. So these techniques are helpful for individuals to manage overwhelming emotions and restore emotional balance. And some of the examples are on your screen there. So you've got journaling, meditation, art therapy, tapping therapy. So when it comes to journaling, this is about writing down thoughts and feelings that can provide clarity and a safe outlet for emotions. Meditation, helps individuals focus, reduce stress, and develop mindfulness to navigate emotional challenges. Art therapy is very effective with young people, especially. So using creative expression, such as painting or drawing, can help process complex emotions in a non-verbal way. Tapping therapy. This involves tapping on specific points of the body to release emotional tension and stress. It's also closely linked to mindfulness. So the goal of these strategies is to restore emotional balance and provide tools for long-term emotional resilience. So just a question, can you think of a situation where a particular emotional regulation technique like journaling or meditation would be especially effective? Let's go with Rainy.
Yeah, I don't know if this is the right answer or not, but when I was in rehab, we had a guy that would come in and he'd like make us meditate and practice mindfulness and all those things. And for me personally, I got a fair bit out of that. I don't know, it just teaches you patience, doesn't it? Like, yeah, so I feel like that's a good one.
What kind of meditation did he teach you guys?
So we just pretty much sat in a room and he'd just put on some meditating sounds and whatnot, and he'd have I don't know, what are they called? Are they called gongs or whatever the things they hit? And yeah, we'd just sit there and close our eyes and he'd like he was a bit weird because he'd like, if someone would talk, he'd come over with like, he had this whacking stick and he'd come over and if he talked, he'd whack you on the back or whatever. So it works.
Yeah, it definitely works. Yeah. It's had a big part of my life as well, mindfulness and meditation as well. It doesn't work for everybody, but it does work for a lot of people. So thank you for that. Kiba?
Something really helpful that I've found when I've had experiences where I've been in extreme crisis, when someone's having a mental health crisis, these emotional regulations are incredibly helpful. But I do want to mention that sometimes that can be unhelpful, but they tend to be pushed onto you. Like meditation doesn't work for me. Journaling does. Journaling and art and writing therapy works very well for me. But I've also found it unhelpful when you talk about that boundary of, meditation is not really for me. And they go, oh, but you just got to try it. So just being mindful that if someone says doesn't necessarily work for them, maybe pull back a little bit, but definitely in a setting of distress, emotional regulation is really, really important.
Yeah, and you made a very good point. And for those mental health professionals who try to force techniques onto their clients, are not doing a very good job, because they've come from a situation where things were forced upon them, and when they come into a session where they want to trust the professional and work on their current situation and getting forced these techniques that they don't enjoy, well, that's not going to really help them. So you got to work with the client to find out their interests and what they like doing and what they want to try, and that's the way to go about it. Edward?
Small thing I wanted to add on to what Ronnie said is when you build that patience up from whatever strategy you decide to use, whatever whether it's meditation, journalism, art therapy, whatever it may be, once you learn to have that patience built up from it, what it allows you to do is be able to, once the scenario happens again, be able to handle larger doses of it or be able to go through it without having as severe of a reaction towards it.
Yeah. So you're building your tolerance
Yes.
to them stressful situations in future, and any triggers that might come in the future as well. Very good. All right. Anger management and trauma care. So, as you would imagine, anger is a common emotional response in trauma care settings. It's important to approach anger management with empathy and effective strategies. On your screen are some strategies that could be used as key techniques. So you've got validate emotions, recognize stages of anger, use visual aids, develop an action plan. So when it comes to validating emotions, this is about letting the individual know their feelings are understandable and valid. This reduces the intensity of the anger. So recognizing their feelings is very important. So recognize stages of anger. So help them identify when they are calm, agitated, or escalating, so they can intervene earlier. So this is very similar to mindfulness. So understanding your own feelings and the stages of your anger is a technique of mindfulness as well. So also using visual aids like drawing or creating a chart of emotions to help them express and understand their anger better. Not for everybody, but again, especially for younger adults, it's, for some of them, it's a good technique. And develop an action plan to prevent anger escalation. So we do this by collaborating with the client to outline steps they can take when they feel their anger is rising, such as stepping away or using calming techniques. So what role does self-awareness play in managing anger, and how can we help our clients develop this awareness?
Can you repeat that? Oh, sorry, the question's there. It's all right.
Yeah, it's all right. I can repeat if you like. So where do we go? One sec. There we are. What roles does self-awareness play in managing anger, and how can we help clients develop this awareness? So I'll start off. So self-awareness plays a critical role in managing anger because it allows individuals to recognize their triggers, emotional responses, and physical signs of anger. So this awareness enables them to, intervene before the anger escalates. And ways to help develop self-awareness include, again, journaling. So encourage them to write about the emotions and triggers, could be on a daily basis. Role-playing scenarios, which is very helpful. help them reflect on how they react and explore alternative responses. The kids that I work with, or the young adults that I work with in the criminal justice system, in corrective services, this is one of the tools that we use with them. Is, when you're in your room, just talk back to yourself and find a more helpful way of response when you're in a conflict situation, and that tends to work a lot. Mindfulness exercises, teaching them to focus on their thoughts and their bodily sensations without judgment, could be one, and also providing constructive insights about their behavior in a safe and supportive environment as well could work.
Is it possible I can add something to what you just said as well?
Of course.
Oh yeah, so basically, I think what role does self-awareness play in managing anger is the self-awareness, I think, also depend on like how well you know about yourself. And when this just I know this is quite subjective because as each individual, we're all subjective, right? So
Mm.
why you feel angry about things is, from my understanding, is there is certain conflict or there's certain expectation not being met, or let's say there's a conflict. And even though there is a conflict, also why people get angry because there is certain expectation that from other people's reply or from your own expectation. So how can we help client to develop this awareness? I would say I totally agree with you that you have to look at yourself to think about what you want. But also I would say kind of saying that sometime if we can sometimes lower a little bit expectation from other people, I think that probably will help as well, because no one is obliged or liable to treat you right or treat you in the way which you want, and also give you the expectation that you expect for certain matters. So sometimes if you don't have that much of expectation, so probably when it's going to different scenario, when there is conflict, probably it will be very helpful that you won't get that much angry, because you will have the much understanding that okay, like this people, what is being happening. So probably, this is what I want, but if I'm not getting what I want, that's okay. Just lower down the expectation. And sometimes I think when this go to the anger management, I learned something from YouTube. I'm not sure this is kind of true or not. It's also in the psychological like ways. When people are getting angry, there is like a 12 seconds rule. It's like, okay, if you're getting angry, if you can kind of survive that within that 12 seconds, when you're really, really like in the stage of exploration, like just like a bomb, if you can survive that 12 seconds, actually your anger will start to like reduce. That's
Yeah.
why sometimes they will kind of introduce a kind of breathing method, like you breathing vessel kind to lower down your breath. So slowly, I think psychologically you kind of help you to reduce the anger level. But more than anything, I think from inner side, I think expectation is a big trigger, because I think when you get angry, sometimes can be a protection mechanism. But in most scenario is, well, the way that people treat you is not aligned with what you think is supposed deserve to be treated. I think this kind of like, how to say, the gap or the misunderstanding is how it trigger the anger. So that's why I said starting from ourselves is gonna be more effective than you expect the people to change and come to your level and make things all right.
Yeah, I agree. Yeah. So, yeah, you're completely right. When it comes to expectations, as the professional, we shouldn't have any expectations, or we shouldn't be setting any concrete expectations or benchmarks for our clients, especially before we even get to know them. And we shouldn't pass judgment if their level of anger is higher or lower than the next person, or their techniques in reducing that anger is different to others. It's like you said, it's about working with the client, getting to know them, and working with them to find techniques that work for them, and hopefully they learn on how to manage their anger a little bit more positively than they did before. And you're right about that 12 seconds. Some people say it's 10 seconds, 12 seconds, 15 seconds. But you're right, if you can redirect your mindset to something else in that 12 seconds and be present in that situation, a lot of the time your anger will drop very quickly in that 12 seconds. Instead of acting on it, just focusing on the present and realizing the situation for what it is. And that anger, more times than none, will go back down and you'll be back in baseline. Yasmin?
Thank you. I'm sorry I'm late, by the way.
That's okay.
So I just read the strategies properly. It said validate emotions. I was kind of going to say something along those lines. Like if a person, a client comes in to see you, they're on the path to want to, recovery, get better, do something about it, I guess. They've made the decision in amongst all the chaos that's going on inside their head. And everything that's just been talked about, I seriously feel like I'm in a therapy session myself. We've got a problem within the family. A family member, and they weren't. There's acceptance. Acceptance is a big deal. If there's a way of getting that person to accept whatever the issue is, and then breathing, I find is very beneficial. And then releasing that issue while talking about it and breathing, recognizing it, validating it, and releasing it. And obviously, what's been mentioned, one thing that works for one person might work for the next. Meditation has healed me. Like it's like magic for me. I guess every now and again, it becomes a bit, had enough of it. I might do it for a little while. But journaling, and then certain other things that you can extend into. I don't know, maybe what is it? Something called Reiki and all these different methods and stuff. But yeah, it doesn't work for everybody. But the recognition of what the problem is, talking about it, releasing it, and if they're there, they kind of, the realization is that they're halfway to getting better anyway, because they wouldn't be there. It's a choice really, if they've come to you as a client. So thank you. I'm enjoying this session. I'm so glad I came today. I wasn't really well today.
No, all good. Thank you for that. So yeah, I agree. So acceptance is very important, and recognizing their bravery and coming to you for to start their journey in recovery is very important. And yeah, I agree. Mindfulness is very effective. Has like you said, it's been for yourself. It's been very effective for myself and a lot of other people as well. So yeah, thanks guys. Olivia, the classes are not compulsory. It's completely up to you if you want to attend. There's no minimum number that you have to attend. And you can always watch the recorded sessions afterwards. Okay. Gender and cultural consideration. So in 1 second, guys. So in trauma care, it is very important to respect and address gender and cultural considerations to ensure safety, comfort, and inclusive environments for everyone involved. On your screen are some examples. So the first one there is women-only service for safety. You got cultural preferences, respecting traditions and gender-specific needs. So when it comes to women-only services for safety, This is about offering spaces or programs exclusively for women, which will provide a sense of security, particularly for the survivors of domestic or gender-based violence. When it comes to cultural preference, respecting Aboriginal protocols could be examples, such as men's or women's business, ensures cultural appropriate engagement and support. Respecting traditions and gender-specific needs. So this includes being mindful of traditional practices, attires, or any cultural sensitivities that impact how individuals access and engage with services. Alona?
It's like, for example, if a client only requesting to talk with a police, that it's only a woman. So yeah, because some are not really comfortable with talking with men, because sometimes we have this stereotype saying like women will understand fellow women. So I think that's sometimes a bit of culture or saying like preferences.
That's an excellent example. Yeah, thank you. Yeah, in a lot of services like the police, you can be given that option as well. Speaking to someone who is a woman or a man, that option could be given as well. So the question I have is, how can we ensure that our services are inclusive and culturally safe for clients, especially those from diverse backgrounds? Kiba?
From personal experience, I can definitely comment on LGBTQIA plus, and the expectations around that. There's specific services for people like me, and it's mostly because we experience a very high rate of domestic and community violence. And so it's very important going into a session that you make sure that you understand what your client is going to need. And if they have cultural or spiritual or religious or just differences to yourself, you need to put your personal feelings aside and you need to help the person under their terms within reason, and make sure that the client feels as comfortable as they can, because it can be a very tough time when they're coming into services like this.
Thank you. My question is to you then, as if you were the employer, how would you get your staff to make sure the service is inclusive and culturally safe? What would you do as the boss to make sure this happens?
Cultural sensitivity training, just
Right, training.
sensitivity training in general.
Yeah.
And also make sure that when incidents do occur, they're not tolerated. It gets pulled up immediately, and it gets made aware that what happened is not okay.
Excellent. Very good. Anyone else? Okay. And it's probably worth mentioning that adapting policies and procedures as well. Our cultural norms and expectations are always changing, so we've got to make sure that the policies and the procedures are changing along with it as well. Okay, recognize, respond, and report. So when working in trauma care, recognizing, responding to, and reporting disclosures of trauma is a very important part of providing support. And as you can see, the steps or the key steps are taking disclosures seriously, validate concerns, report incidents following protocols, developing safety plans as needed. So when it comes to step one, we have to always listen and attentively and acknowledge the courage it takes for someone to share their experience. And by doing that, you're also building trust and rapport with the client. And when it comes to validating concerns, reassure the individual that their feelings and experience are valid and that they are being heard without any judgment. And this is where active listening comes into place as well. Report incidents following protocols, so ensuring you follow the organizations and the policy and procedure, and also your legal requirements when reporting disclosures. This protects both the individual and yourself as the professional. And the last one there is develop safety plans as needed. So this is done in collaboration with the individual to create a plan that addresses their immediate and long-term safety. So what challenges might you face when reporting a disclosure of trauma, and how can they be addressed? Rainy?
I think aid, like, you know, aid, if it's a young child, that makes it that would be a challenge, I think,
Mm-hmm.
in itself.
Yeah, I agree. How would that be a challenge though?
Well, I guess depending on the age, you know, like you know, if there's a young kid that's 4 or 5, or do you know what I mean? Like,
Yeah.
they can't really explain properly what they're actually meaning. Like, that would be a challenging situation as a worker to try and handle.
Yeah, it would be, because you don't really know if they're overstating or understating what actually happened to them.
Yeah.
And also their guardians and parents come into play as well.
Yeah.
But in the same time, you don't want to overstep the mark, but you've got the responsibility for the child in your care as well. So that is a tricky one, yeah. Did you have anything else, Rainy? No, you're good. Kiba?
To add on to the child one, you can also have parents that, if they get wind that potentially, say for example, if a child is being abused and they get wind that the child has told you, it could potentially be devastating for the child, because they could pull the child from services, and that's how children have died, because they just pull them out of the services. And yeah, there's not a lot you can do, unfortunately, when you can just report it to child safety and it's out of your hands. So just being very careful that you respect the child's confidentiality as well as the parental rights to know what's going on.
Yeah. Exactly. So all you can do is follow policy and procedure, report it to the police, child protection, do your incident reports, let your superiors know what's happening. Unfortunately, the parents do sometimes do what they do, and that's out of our hands. Unfortunately, there's not much we can do. But thank you for that, Rainy.
Yeah, just another challenge. Like, how would you go get around like a non-verbal client, and you know, how would you get around a complaint or you know, a disclosure in that sense? Because I'm sure, like, they're non-verbal, they're able to get it out, but do you know what I mean? I don't know. I'm not sure the word. I don't know what the word is I'm trying to find, but
Yeah. No, that's that's come to, so alongside working with corrective services, I manage a house, and we got a autistic client who's completely non-verbal,
right.
so he can't speak at all.
Yeah.
He had bruises. He came from school and he had bruises around his wrist
Yeah.
and his around his neck, and he was in distress when he came back from home. And the only time he communicates with us somewhat is when we're reading books to him.
Right.
So at that time, I got his favorite, his books out, and we were reading. And then as I was reading, he was reading with me. I was trying to, and then as I flick the page, I would ask him a question, like a open-ended question. Did that
Yeah.
happen in school? And he would nod. Okay. And I'll read the next page, and I'll ask him another question. Did the teacher do it? He will say no. I said, okay. Did one of the students, and then I'll keep reading. Did one of the students do it? Yeah. So It's just about knowing your client and get into the, so if you meet a client for the first time who is autistic, you're not going to know to do that because you don't know what he likes doing and all that sort of stuff.
Yeah.
So my answer would be getting to know the client, getting to know their interests, and using their interests in communicating with them.
Yeah, cool.
Yeah. Kiba?
To add to the autism thing, there are actual charts, and that it's for people who can't talk as well. There are charts with basic phrases on them that you can pick up, and you can use that to communicate. Or sometimes they'd be willing to write. Sometimes they're willing to use pictures to communicate. Sometimes they're willing to, like sometimes I'm unable to verbalize. So sometimes when that happens, it's not as bad as it used to be. But when that happened, I would carry a pen and paper with me. Or if I couldn't do that, I'd have my phone on me and I would type and I would show a person the sentence that I'm trying to get out. So there's multiple ways, yeah.
Thank you. Anyone else, guys? Okay. All right. Self-harm and risky behavior. So self-harm and risky behavior are often used as a maladaptive coping strategy to deal with overwhelming emotions or past trauma. So examples are cutting, burning, or engaging in other self-injury behaviors. Risky behaviors is one, addressing underlying trauma and developing safer alternatives. That's as supports. Okay. So when it comes to examples of self-harm or risky behavior, we all know what's cutting and burning is all about. When it comes to risk behavior, it involves such things like substance abuse, reckless driving, or trying to, I don't know what they call it, train surfing or whatever the young guys do these days, to endanger their safety. And to support people who are going through or displaying this sort of behavior, you can do things like addressing underlying trauma, so understanding the root causes that drive these behaviors and provide appropriate therapeutic support or other alternatives to that behavior. Develops safe alternatives, like I said, so helping clients identify and practice healthier coping mechanisms, again, such as mindfulness, journaling, or grounding exercises. So, what are some ways to build trust with a client who uses self-harm as a coping mechanism? Kiba?
A really good coping strategy for them is, and I've done this myself, you get a rubber or elastic band and you pop it around your wrist usually, or you can pop it around your ankle, I've seen some people do. And whenever you get that urge, you pull it back, you let it go, and it gives that little sharp bit of pain without causing any damage. Or there is another tactic, I don't remember what the tactic's called, but essentially you get like a bowl of ice water and you put your hands in it and it simulates the painful things you get from the urge. So
Yeah, definitely. Thank you for that. Anyone else, guys? So, what are some ways to build trust with a client who uses self-harm as a coping mechanism? Edward?
To not provide them with any blame, shame, or direct what's the word? Direct, I'd say notice towards it, because some clients may feel targeted or offended to some degree if when you're talking to them, that might be one of the first things that you bring up. So to possibly maybe slowly edge it in conversations or subtly hint towards that sort of what would it coping strategy that they use would be much more healthier, not only for your trust with them, but also for their own mental stability during the conversations.
Yeah. So Excellent. So yeah, we don't want to focus on their injuries or the actions they're taking to cause that self-harm. We want to uncover what the trauma is and what they're going through for them to take them actions.
Yeah, try and build a actual connection with them before you get to any serious
Excellent.
issues.
Yeah. So you want to build empathy and understanding with the client.
Yeah.
Very good. All right. Kiba?
Sorry, I didn't realize my hand was still up.
All good.
My bad.
All good. So other things would be, which were mentioned, providing a non-judgmental space, active listening. When individual self-harms or hurts themselves, they don't want someone telling them what they did was wrong because they already know what they're doing is not helpful for them. It may make them feel better, but they know deep inside that it's not it's not a nice thing to do to yourself. It doesn't make them feel better, but they know what the truth is when it comes to that sort of stuff. So it's about listening to why they're doing it, pay close attention to their words and emotions without offering immediate solutions like Edward touched on as well, empowering them, so collaborating to explore safer coping mechanisms while respecting their autonomy and pace. This is a tricky one when it comes to self-harm as well, is because when you're offering other alternatives, sometimes it could be a bit of a insult, or it's like you're looking down on them when because they are self-harm. So you got to make sure when you're wording things or when you're talking to them that you're not um, making them feel any worse than what they are. Maintaining consistency is very important. So being reliable in your interactions, showing them they can trust you and count on you is very important. Explaining your role and boundaries is very important as well. So clearly outlining how you can help them and the limits of confidentiality, ensuring transparency as well. Okay, case study. Hopefully you guys can see that. I'll read it out anyway. So Emily is a 17-year-old who has faced significant trauma throughout her life, growing up in a household where her parents struggled with substance abuse. Emily often felt invisible. Her father was frequently absent. Her mother's emotional neglect and verbal criticism left Emily feeling unworthy of love and care. By the age of 12, Emily entered the foster care system after her mother's overdose. She moved through multiple placements, experiencing instability and further emotional neglect. Now living with a foster family, Emily struggles to connect with those around her. She avoids forming relationships, keeping her emotions bottled up. She has described feeling like a burden and believes no one truly cares about her. When Emily feels overwhelmed, she copes by cutting herself, saying it provides her with a sense of control and relief. At school, she is often withdrawn and struggles to concentrate, and her teachers have noticed a decline in her academic performance. Emily has agreed to attend sessions with a counselor but remains hesitant to engage. During her first session, she avoids eye contact and gives short, guarded answers. When asked about her self-harm, she says, "It's just the only thing that works," before shutting down and refusing to talk further. So the questions are, what strategies could help Emily regulate her emotions and reduce self-harming behaviors? How would you address Emily's self-harming behavior in a trauma-informed way? So I'll give you guys 10 minutes to discuss this as a group, answering the questions. I just ask that you guys all give each other a chance to speak as well, just to get everyone involved. That will be appreciated. So I'll see you guys in 10 minutes.
Mm. So she's 17 and she's living in foster care. She's receiving help. She's not engaging. Oh. I think I would look at what she's doing as far as her control issues. Oh,
Yeah.
Give her some strategies.
Yeah, I was gonna
So what
say.
strategies could help her regulate her emotions?
Art therapy?
Deep breathing.
Yeah, I'd say that you'd have to before you talk about anything, you'd ask if she has anything that helps her cope with, like with what she's dealing with, whether it's like art therapy or
Cutting.
yeah.
That's what she said is that's the only thing that works.
Well, yeah. Well, in that case, then yeah, going over those different strategies would be the first thing.
Mm.
I feel that from the case study, there's a very important message which has been disclosed in the article is why he feel that only works because that's the only way she feel that he can get the control of herself by harming herself, right? So this means she actually wants control of her life. And the only problem is because the way she got brought up, right? Her closest like caretaker, he has been like neglected through the whole way out. So
Yeah.
her feeling
So-
has never been validated. So if I want to help her, I would try to basically he doesn't have families. The thing when she was born, he has been experiencing miserable life. There's no care, no feeling, no love and affections, which the basic things for people to live a normal life. So he doesn't know like how to social in the how to say, I won't say normal way, but at least
she'd be very untrusting
generalized way.
Yes.
of anybody who showed her that kind of attention as well. It's like she's withdrawn into herself because anyone at school and all the rest of it, she's withdrawn and she's declining in her academic performance. So she's obviously saying she's pushing everyone away, not just family, because she's associating herself from.
Yeah, and also I think for that kind of kid, yeah, I agree with you because in my experience, not like I had similar experience, just from what I have read was the information I've gathered. Normally, the kids who grew up in that kind of the environment, they normally have very low self-esteem as well, and also potentially they have very low self-awareness, right? So they don't have the kind of like normal social skills. And they really sometimes they just detach themselves from the world around them. So they're very isolated. So if I want to help this girl, like I said, I will start to make her realize like it's normal that you can have feelings, and what has been happening to you obviously it's not something he deserves, and I won't bring it up, but I think through the way out, once he start like telling her feelings, I think slowly he probably will kind of start telling, okay, those kind of feelings is related to what kind of experience you had in life. Once if we can try to get her to open up to.
Yeah, she needs validation.
Yeah.
Her feelings.
The right way to go about.
Mm.
Yeah.
Building
Yeah.
that
If
emotional
she's
foundation.
unable to open up, could you possibly introduce her to journaling?
Yeah, that's a good
Because she
one.
doesn't want to speak. That's true. Yeah.
Or maybe I think it's a trauma, like in from kids. The first thing I think we need to build up this kind of safety, right? And I will probably just try to tell her that now. You have full control of your life. Let her to feel safe with her, like, okay, even for this conversation, if something you feel uncomfortable, you don't want to talk about, it's totally up to you because you are the expert of your life. Okay. So whatever you want to tell, no issues. Okay. Just try to give her the control that you need little by little. I guess that that's probably how we can get her talking. Otherwise, I think from a girl who really had a life experience like that, that's just yeah, also it's pretty hard.
Yeah. 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 I think building up that foundation before going into any techniques or strategies is the best way.
We're not really looking at crisis care at this point, are we? We're looking at trauma-informed care.
Yeah.
So it's not a crisis intervention that we have to look at.
Yeah.
So yeah, it's more even introducing, as Kiwa said, a rubber band if you have the control of flicking that rubber band.
Yeah.
Introduce dangerous methods of giving her control over her emotions.
Yeah.
She probably feels like with her harming, she probably feels a little bit different to everyone else. So you would try and build that safe area where she understands that it's actually a quite a normal sort of things to happen and normalize what she's going through.
Another thing you can reassure her is because it gives her control. That's ultimately why she's doing it. So giving her a sense of control could help ease everything, but yeah, it depends.
Or I don't know this is something like would work or not, but I probably try to kind of shift her like attention from all the pain by asking her that, you know, what is her like normal life? Is this something which she's interested of doing, like her hobby or something? Because I guess when someone is talking about what is kind of like the light of in their life, is it kind of like lifted their mood a little bit. So it's kind of like it shifted their negativities for another bright place. So probably that's gonna work because based on this case study from how like her life was like, basically in her world, everything he's been through to make her like believe that like she's not being this, nobody cares about her, and nobody wants to understand her. So basically he just feel like, she doesn't deserve things in like in this world. So if I think we would try to just listen to her interest, try to feel like we really care by talking to something she probably interested to talk, then maybe can be a good start as well. Basically, just do something to get her to talk. Like I'm pretty sure, unless you have completely like that kind of like a drive to live, like you feel everything around you is gray, is or gray and black. You should have something like in life. Doesn't matter how small it is. Should be something can lift up your mood even a little bit. For example, like for me, I like to watch movies. I'm a foodie. Something that probably interests you just can shift you from that dark place, like temporarily.
Even puppies.
Yeah.
Things like going and seeing puppies.
Yeah, because I think people like, especially they like small things, not necessarily to be animal, but like small baby, cute things. This is just a human nature. Yeah, so just find something in common or like something she likes to do, something interests her, or something will bring her a little bit joy in her life. That probably I think can be a start as well. What do you guys say?
Yeah.
A reward system could also be beneficial.
Yes,
Like if
correct.
she goes a certain amount of time without self-harming, you put a reward system in place appropriate to her age.
Yeah, yeah. This is a great. This is a great angle actually.
Yeah, I agree with that. That was a good. Yeah.
Severe thunderstorm warning for
Severe thunderstorm warning for you guys too.
Yeah, I'm just about to get slammed in about 4 minutes, so I might lose everything.
Are you in Queensland, Karen?
No, I'm in just Central Coast, New South
Okay.
Wales.
Mm.
We have a nice little spot coming over us.
I have to head off, but I will watch the recording back if that's okay.
No problem. Have a
All right,
enjoy the rest of your evening.
you too. Take care. Bye.
See you, Kayla.
Have a good day.
Bye. You too.
Okay, guys. I was listening to you guys discuss that case study. There's not much else I would add to that. So well done. So we'll have our 10-minute break now, and then we'll come back and we'll try to cover some assessment material as well. All right. So I'll see you guys in 10 minutes.
All right.
Now, all right. So one of the assessments, I'm pretty sure we covered the quiz in the last one. I don't think we covered this before the break. So this is the case study assessment. There's 2 case studies that need to be completed. One is about Belinda, the other one is about Farida, or Feride, however you want to pronounce it. So let's go over the first one, Belinda. So Belinda is 19, is a client in First Access Program Early Intervention and Prevention for Young People at Risk. Belinda participates in mental health support services provided under this program. You work as a support worker in this program. Your job is to work one-on-one with clients in the program using trauma-informed approach. Your job is to support and empower the client as they work towards recovery from illness. You also refer clients to other services which may facilitate their recovery, including employment services, further study, pathways, social activities, and art workshops. Linda also received support from another program and first accessed the Safe Haven program. She has long-term accommodation with Safe Haven after running away from home at the age of 18 and living in the streets. Belinda ran away from home after being released from involuntary detention and treatment in a mental health facility at the age of 17. Belinda was placed in involuntary detention by the police. The police responded to requests from Belinda's parents to detain her in mental health ward after they read her personal journal, which recorded her suicidal thoughts and intentions. Belinda's father, Jack, is a preacher for a long evangelical church. He believes that suicide is a sin. When he found out that Belinda was suicidal, he called the police to get her detained and even lied to the police saying that he caught her in the middle of a suicide attempt to ensure she would be detained. When Belinda told the police the story wasn't true, they didn't believe her. Belinda was detained in the mental health ward in hospital in rural New South Wales at the age of 17 and remained there for 3 months. She was repeatedly restrained because she yelled at staff that her father was a liar and that demanded to be released. She was forcibly sedated as a treatment for depression. Belinda was given electroconvulsive therapy, shock therapy, 9 times without her consent. After her release from hospital, Belinda ran away and caught a bus to Sydney, where she was living on the streets when she first encountered First Access morning coffee van for the homeless. Belinda has been a client of First Access for past 1.5 years. Recently, another client who lived in South Haven facility where Belinda informed you that Belinda is suicidal. She's never mentioned suicidal thoughts to you, her support worker. To you as a support worker, you are concerned that Belinda may attempt suicide and will like to complete a suicide safety plan with her. So part A of this is Belinda has told another client that she is suicidal, but she has not told you, her support worker. Consider the reasons why Belinda might avoid telling you. Use a trauma-informed approach to answer the question and consider re-traumatization. Does anyone want to start off? So consider the reason why Belinda might avoid telling you. Mickey? You're just on mute. Just on mute, Mickey. You're still on mute.
Oh, can you hear me now?
Yep.
Okay, sorry about it. Sorry about it. Because I just figured out how to put hands up now. Sorry. Yeah, so I think the main reason is I think firstly she doesn't feel safe with me. I think the safe environment has been like formed so far, even though I have been her caseworker. That's why she's feel more like comfortable of talking to the clients rather than the caseworker like myself. And the second of all is why she's telling to another client. So maybe as a client, they may all have kind of different like traumas, like trauma. So they do find something in common because underneath the trauma, they do have that kind of pain, either physical or psychological. So you feel more comfortable because she can kind of relate it to her. So as a caseworker, I would say the reason would be um she still trusts me enough to tell me that, and also it could be something to do with the disclosure. So maybe he has a kind of fear that if he told me like she's suicidal, like maybe like he has the kind of concern whether everything the conversation is confidential enough that she won't get in trouble by telling this. So I think this is what I can think of.
Yeah, so she's not saying anything because she's fearful that you might send her to the mental ward like her parents did. So she's got that around that. Aaron?
Sorry, just trying to cancel this damn thing. Stop. Okay. Expecting a lot of rain. I was yeah, she's never mentioned suicidal thoughts to you as her support worker. You need to kind of recognize that the last time she did let anybody know that she had suicidal thoughts, she was locked up and subjected to horrendous treatment against her will.
Yep.
So I think the first thing you really need to do is reread the confidentiality section to her, that everything is actually confidential. You're not at a crisis point at the moment. You're having some suicidal thoughts, but you haven't tried to kill yourself. I don't have to intervene.
Yeah.
But I can talk to you about why it is that you might be having some of these thoughts.
Yeah.
But everything that you say to me can remain confidential.
Yeah.
And really reinforce that, because it's if she hasn't mentioned anything, then it's quite highly likely that she just still hasn't got that trust that it's not going to be passed on.
Exactly. Yeah. So she doesn't trust us because of what's happened to her
Doesn't
previous.
trust the system. Yeah.
Yeah, didn't trust their parents for what they did, and then
Severe thunderstorm warning for Hunter.
what she suffered in the hospital as well. So when it comes to the first part of the question, consider the reasons why Belinda might avoid telling you. So you guys have raised some good ones. So this is about she's probably have an issue in disclosing suicidal thoughts, as it's likely to re-traumatize her. It may trigger flashbacks or difficult memories that she's trying to avoid. It may cause difficult emotions like fear, anger, and powerlessness. It may make the environment feel unsafe, so making first access feel safe for her when she at the moment feels safe. So she probably doesn't want to change that feeling that she has at first access. She may fear that what the support worker will do, like re-hospitalizing or having the police called as well, might be an issue. So the second part of that question is use a trauma-informed approach to answer the question and consider re-traumatization. So when Belinda is reminded of her past experiences, like I said, she may be re-traumatized. For example, if she discusses suicide with a mental health worker, it may trigger traumatic flashbacks to her time in the hospital. It may also cause her to feel fear, shame, anger, suspicion, helplessness, and powerlessness. Therefore, to avoid re-traumatization, she may avoid discussing suicide with mental health workers. Discussing her suicidal thoughts might also make the environment at first access feel unsafe for Belinda, like I said before, as she may wonder about the potential reaction if she discloses suicidal thoughts. She may feel a lack of trust and control as well at that point. She may feel that first access will call the police or have her involuntarily detained, like it happened to her in the past. All right, so how could you increase Belinda's feelings of safety at first access, considering part A? What would you do? What would you do, or what would you say? What strategies would you implement to increase Belinda's feelings of safety at first access? Mickey?
Let me check. Oh yeah, so I'll mute it back. So basically, I will start it as the by introducing the confidentiality procedure. So I will make sure that explaining to her that whatever the conversation when we're gonna have, what we're gonna have is completely confidential, just between you and me, unless without her permission, all this information will just stay here. So to make her feel safe, that you can tell me and all this information, and you have the choice of telling me whatever you want. And if you don't feel comfortable of talking about anything, for example, like you just mentioned, he doesn't want to get re-traumatized by telling what has been happening or what he's gonna do, I'll give her the control that, and if any topic that we are talking it make you feel uncomfortable, you have every right to stop it. And if you want to give a little bit more time for yourself to answer certain questions, so please like tell me. So you are gonna be the one who controls the conversation, and also let's take the pace which you feel comfortable. So basically, I will try to like make sure and put her guard down that there's a safe environment, no information is gonna get leaked out, and also all the conversation is gonna be taken under her base and her and depending on how comfortable you want to talk about it. Yeah.
Yeah, excellent. Very good. Rainy?
Yeah, I think it's kind of a tricky situation with someone that's already sort of, she's been through the system and she knows, like, she obviously would know that it is, the work, as it's you as a worker, she would know that it's your duty of care to report any self-harming thoughts and stuff like that. So it's hard to get someone to open up about the potential of wanting to self-harm, because she's fully aware that you sort of have to tell someone else.
Yep.
Whether it obviously you're not, I don't think you're not allowed to really call her parents, but it's mandatory to report it to the police, isn't it?
If you got if you're worried that she is imminent danger to herself, yes, you have to call the police.
Yeah.
But if you feel like she's not and it's just thoughts,
Yeah.
don't. You would have to refer her to a psychologist or a professional counselor.
Right, okay.
As it's sort of outside your scope.
Yeah.
Like, you can support her, but
You can't diagnose. Yeah.
that's right. Yeah.
Yeah.
I think at this, yeah. Actually, how old is she now? She's 19. Okay. So yeah, you wouldn't have to call her parents, as she's an adult as well. But yeah, they're all valid answers, guys. Excellent. Alona?
I can see the issue that is about trust. And so the solution to what I think is a building trust. And so showing her all the precautionary measures, all the safety procedures, and also, if possible, the evidence-based and validation too.
Yeah, it's very important because the information wasn't disclosed by her, it was disclosed by a friend that's concerned about her. So you don't want to lose trust of the other client as well, and also cause an issue between the two friends. So you got to find the way to, like Alona said, build trust and get her to open up and get her to tell you about her suicidal thoughts and her challenges at that time. A lot of clients, that will take time for her to make that disclosure. But again, remember to get clients to open up. You have to. It's a good strategy to follow the trauma-informed care principles, which is about building trust, providing a safe environment, collaboration, empowering the client to speak up, giving her power and control over the conversation as well, not dictating to her how things will be done, work out a safety plan with her that she agrees with as well. And a very important point in the beginning, usually if you start with talking about confidentiality, the confidentiality policy and procedures for the organization, that usually instills a bit of trust with the client as well, because then they understand, they're not they're not allowed legally to share my information without my consent unless I'm in imminent danger. Okay, so part C, how would you apply these principles when working with Belinda? Refer to each of the 6 core principles of trauma-informed care in your answer. So let's start with safety. Rainey?
Yeah, so you would obviously want to just make her feel like she's in a safe and trusted. Oh, that's the next one. But yeah, safe environment where she can open up without the thought of being judged or I guess misled to the wrong care. Yeah, that's what I've got.
Yeah, that the last point is it's a really good one. So you would explain the values of the organization, which is First Access, and how they differ from the mental health system or the mental health hospital that she was in before.
Yeah.
So just making pointing out the differences and the differences in style of therapy and the way they approach mental health. So you would also focus on client consent and awareness.
Yeah.
During the treatment process, you would explain the First Access clients are active partners in the process, so all about collaboration rather than subject of the process. So before you said you were talking about safety, but it's trust, but well, a lot of these principles overlap each other. So when you're providing safety, that's what trust comes in, choice comes in. When you talk about collaboration, that also entails safety and empowerment. So they all overlap each other as well. What about trust, guys? Can anyone have a go at trust? All right, I'll have a go at this one. So I would probably seek to create a feeling of trust, obviously for Belinda, by explaining exactly when, what, and who I would disclose, or who I would disclose the client information to, or which third party. I will explain that just talking or thinking about suicide will not be a reason to refer to someone else. So if she's worried about going back to the hospital or the police getting involved, I will make sure I convey that message effectively. I would explain that just talking or thinking about suicide will not be a reason to refer you to the police or to the hospital. I would also explain to her the ethics that I or workers under First Access work under, and particularly client rights as well. What about choice? How would you apply the principle of choice when working with Belinda? So you would ensure that she understands that everything at First Access is a choice for her, including whether she chooses to participate in the session or not to, who she chooses to work with or doesn't want to work with, or what she wants to share. I would also seek to work with Belinda to understand that choosing to share her difficulties might make it possible to work through them as a team through collaboration. I would also discuss the suicide safety plan transparently and explain to her what it is for and who can actually read it and see it as well, making it clear of the people who will be involved in the plan. What about collaboration, Elena?
In addition with what you said, also probably a good thing probably with Belinda is giving her a choice as well when she is ready to tell her story, or to when she is ready that everyone will gonna, or I'm like a caseworker to listen with her story.
Yeah. So not giving her a time frame on when to tell you.
Yeah.
Yeah.
Because because sort like if I read on it, it's really like a very complex trauma. So it's a severe trauma that it really a bit of time, or like, for example, even like she already started building trust, but once a caseworker will, like, the word and the action doesn't collaborate, then it will lose as well. All the trust that was being built will losing as well.
Yeah, and exactly. So it's important to build trust and safety for her to feel comfortable in sharing her story. And from my experience working with individuals who have self-harmed, and if when they want help, they will either make their injuries visible for you to see, or they will talk to you when they trust and they feel safe. They're the two ways that, from my experience, are the ways they disclose their suicidal thoughts or their current state, is by, again, showing their visible injuries or make it visible for you to see, or coming and talking to you at their own accord. Mickey? I think, yeah.
Yeah. So actually you actually uh did actually quite a great thing by looking at how old was the girl. And if I remember in the article it mentioned she's 19. So my question is, when she's 19, so basically like you said, like legally he's an adult. So she does have full right to make a decision for what she wants. Is that correct?
Yeah.
So if that's the case, he's not gonna be treated as a juvenile case. He'll be like treated just like an adult case. So if that's the case, I would just be fully like transparent with her. Just tell her what's her right, and just like you said, just totally transparent. Like say, if there's a plan, who's gonna get involved, and what the procedure would be without any like cancellation of the information and or any misleading information. So let her to make a decision, because I want to validate her feeling is she's in control of everything, and she's 19, he's an adult. He has a full right and authority to decide what's gonna happen next. So what I'm here to do is just simply offer solution and options. But at the end of the day, she's gonna be the one who makes the decision. Simple as that. So I'm just here to help and facilitate, but she's the expert of her life. She knows the best, and I'm just simply here to facilitate the whole process. So I would feel completely transparency with her. I think this is the way.
Yeah, you're spot on. So as a support worker, your job is to provide the options, the strategies, and the path forward for her to take. And like you said, it's her decision to make if she's going to take that path to recovery. And like you said, it's our role to make sure she understands that she is an adult, that she is in control of her life, and she's the only one that can make the final decision in taking action about her suicidal thoughts and her current situation. So yeah, excellent. All right. Alona?
We have also to consider that emotional intelligence or maturity is not something to do with the age, but it's also with the life experience that the person had been through. So as a support worker, that's why we have called the interviewing. So we got to know with also reading with the case study. So that we have the background in history of the status of the person's mental state. So but we still have the collaboration with the client, and until we get through what the assistance and the needs that this person really we can support of.
Very good. All right, let's go on to collaboration. So in terms of collaboration, you could explain to Belinda that the safety plan that you're trying to create with her is a safe opportunity to work together to develop other or alternative plans that Belinda can use when she's thinking about suicide or suicidal ideations. So again, like you guys have said, like Mickey has just said before, everything is up to her, but we also seek to understand how us as the workers for First Access might be able to become partners to support Belinda in this process that she's going through as well. Empowerment. So as we know, Belinda has survived a lot and used adaptive strategies that has displayed her resilience and agency. I would seek to empower Belinda by using strength-based approach, by acknowledging her strengths and encouraging a focus on strengths. I will also promote the belief that recovery is possible for her, always reminding her that, you know, it is possible and giving her examples of other people without naming them, obviously, but just letting her know she's not the first or won't be the last of many people who've had these thoughts of suicidal ideations. And respect for diversity. So this is about working with an awareness that Belinda's life experiences are unique, like Alona stated it as well, and so are her coping strategies. So I would refrain from judging Belinda's coping strategies or behaviors, like the maladaptive strategies that she's been using in the present. All right, so that's Belinda. Let's go on to Farida or Farida. So she's 23 years old, client of First Access. She was referred to by the GP to access support with mental health and domestic violence issues. Farida participates in mental health support services as part of an outreach program. You are the support worker in the program. Your job is to work one-on-one with the client in the program using trauma-informed approach. Farida studied accounting at the University of Jordan and is fluent in English, French, and Arabic. At the age of 18, Farida married her husband, Adil, when he was on holiday in Jordan visiting family. Adil grew up in Australia. Farida moved to Australia immediately after the wedding and experienced a huge and sudden change in her social and cultural life. Her husband pretended to be very open-minded when speaking with Farida and her family in Jordan, but on arrival in Australia, Adil told her that she was not allowed to continue her studies. Farida became pregnant soon after with the first child, Hamad, 4 years old. She has since had a second child, Jamila, who is 2 years old, and she is currently pregnant with her and Adil's third child. Farida loves her children, but finds life in Australia very cold and isolating compared to her rich family and social life in Jordan, where she had many friends and large extended family. All these changes have caused Farida to become depressed. Her depression was first diagnosed after the birth of her first child and has recently become worse since she realized she was pregnant again. Farida previously confided in you that her husband Adil beats her sometimes for disobedience. A few months ago, Farida overheard another support worker in the car park saying that Arab men are violent and misogynist. After that, Farida told you that the violence had stopped. Her husband was showing more care towards her and she was beginning to feel better about the pregnancy. She stopped coming to First Access and told you her mental health was much better. Farida's GP called you last week to express concerns that both the violence and Farida's mental health situation was becoming worse. Farida has a close relationship with her GP Azad Al-Hamadi, who was originally from Iraq and speaks Arabic. According to the GP, recently Adil has been beating Farida more frequently. Adil also suspects that she has boyfriends who she sees while he is at work. So he has installed tracking software on our mobile phone. Azad is concerned for Farida's safety and asks you what services First Access could provide if Farida and the kids needed emergency accommodation. So the first part, or the first question is, migrants who experience domestic violence and mental health illness face a triple stigma. How might this affect their access to services and way of engaging with services? Mickey?
Firstly, as a migrant myself, I would say firstly is language barrier, right? Because sometimes as English is not our first language, so to a certain extent, maybe the communication can be a barrier between um the migrants and to, let's say, of course we would have the choice of choosing some caseworker who speak the same language, but let's say language could be a potential barrier. Second is I would say the diversity in the culture and the religion. Because I'm not sure, but like say Frida, who's from Jordan, and and her husband are like, I assume they could be Muslim. I don't know too much about the Muslim culture, so and the religion. But because the culture and the religion like differences, there could be something like they would not preferred in the let's say telling, for example, whatever is happening at home freely to the caseworker. For example, I'm a Chinese. For us, we do have a culture that whatever happening at home, we keep it in the closet. So we don't really like to like tell people outside as a, how to say, a self, as a protection of self-esteem and as a cultural influence as well. So this could be the barrier as well. That's why this is like a triple stigma. And light away migrant, but based on this instance also, because I know I have two boys, and I do know when I was pregnant, there are a lot of like hormone like changes, and sometimes that's definitely can change like um insecurity. Like I'll feel like insecure. I feel like depression during the pregnancy. Something could be purely due to the hormone as well. So along with the pregnancy, once when the hormones start changing, a lot of situation could be different. Maybe the same scenario, we will have different understanding of it. So this could be uh, the reason too, because when the time changes, the same matter probably won't stay the same anymore.
Yeah, definitely, yeah. Anyone else, guys? Elena?
I would just add to that isolation and cultural shock as well.
Yeah.
And because it doesn't mean like, for example, let's say Adele might be from Jordan as well, but he born and raised in Australia, so he's already adopting the culture here, and it's so there's a changes. And also because she came from Jordan, so there's probably still having this Islamic culture that's saying like women are submissive. And then when she come here in Australia, she learned that the equality between so the like there's no imbalance of power. So I think there is like a cultural adjustment, and um getting to know as well more about the society in Australia. So, which is that's another way of into her of uh, all of it. That oh, sorry, I can't say any words because it's really so. This case is so really close to my heart. So it's a bit of a it's it pricked me.
All right. Thank you, Elena. So in terms of Faride in Jordan, it seems like she lived a pretty happy life. She was studying in university. She was in the University of Jordan. She was 18. She was fluent in English, French, and Arabic, which would someone would consider as a very educated young lady. It seems like her family had expectations that her husband will continue this, make sure this continues when she moves to Australia. So that they had this expectation especially when moving to Australia, that she would have more freedoms. Unfortunately for her, this was the complete opposite to what she expected, even though the husband said otherwise, which is a shame. Elena?
I think the shocking probably for her is the control.
Mm.
Yeah.
Yeah, definitely, yeah. It seems like she would, there definitely shock will come into it because it doesn't seem like she went through this sort of trauma with her father or any male in her life. She lived a pretty happy life from what I could read.
Yeah. I think it's the control. It and you know, like being she's taking away like the freedom. So she's under the thumb of her husband. That used to be she's enjoying the freedom and independence. She's in control of herself. She have all the choice and options in her life. And so when coming in here, she feel like being trapped.
Mm. Yep, that's what it sounds like it's happened to her. So
And it's happened to me.
yeah.
Sorry. So yeah, that's it.
So certain population groups face barriers seeking support with issues like mental illness and domestic violence. So people from migrant backgrounds may face barriers in accessing services due to suspicion about the service as well. So lack of clarity about the policies and procedures of the service, lack of clarity about links with government or church organizations, language barriers, past experiences of racism with the service or similar services, feeling of being the outsider, feeling of guilt for betraying her own community, and reluctance to air dirty laundry in public, like Mickey touched on before. So discuss issues in own family and community with cultural outsiders is it's a big no-no in a lot of cultures. In addition to this, if a client is experiencing domestic violence, they may face some barriers accessing services due to being afraid to talk to someone, feeling nervous that they will not be believed, and feeling wary of being judged as well. In addition to this, to the barriers people already face in accessing support for mental health issues, which include shame, fear of being misunderstood, and also afraid of being diagnosed with mental illness as well, would be a fear. All right, let's move on to part B. How would you apply these principles when working with a Faraday? So, how would you apply safety when it comes to Faraday? Mickey?
Firstly, from the culture aspect, I would firstly ask her, do you feel comfortable of talking to, like, say, an Australian case, or you prefer someone who comes from the same background or same religious, like culture background, or even from the same country who speak the same language? Because as a migrant, I always will have the kind of natural, how to say, I won't call it affection, but comfort with my own people. Because we speak the same language, we have similar cultural background. This kind of put my guard down in the first place. So this is the first thing. And the second of all, based on her case, she's like pregnant lady. So I want to try to judge her. Like I said, even though I'm a mom, I do understand during pregnancy, not only the instant matters and also personal hormone, also emotion matters. I will give her full respect to that. Okay. Light as a hormone aside, okay, and try to be more feel her as a woman's perspective. So this is the second thing. And the last is I'll be very transparent with her by telling her whatever the conversation and whatever we're gonna do later on is fully confidential. So he doesn't have to scare, like I said, will give the dirty laundry from home and feel like shame or told me anything. Whatever, like I said, whatever happens here stays here. Without her permission, nothing's gonna get disclosed outside. So he can have the options. She doesn't need to have the concern that the information, whatever happened in the home, it will be disclosed to the third party or like without permission. So that's probably how I would start with the like safety. Basically, just to try to put her gut down and make her feel comfortable talking to me, and also like her to choose, does she prefer talk to a man or women? Just give her the choice from the choices that she has from my end, and I would try to definitely fully support and try to make it happen. Yeah.
Excellent. So, very important what you mentioned is to always start with privacy and confidentiality would be important concept to discuss with the client right in the beginning. That some people might think when they hear that, oh, that's not a big deal, but it is, especially for someone who's going through this sort of situation. Knowing that her story and what she's going to share is going to stay within the confined walls that she's in is a very good support for her, knowing that that information is not going to go anywhere else. In terms of having people like women or people from the same culture to work with, excellent. That's very common now in government agencies, in community service agencies. For example, I work for Youth Justice in one of the correctional centres. I'm actively looking for a identified Aboriginal Torres Strait Islander mentor to work with the young people. And if you look online, there are a lot of jobs out there that would title Chinese caseworker, a Samoan caseworker, Arabic speaking caseworker, Turkish caseworker. So people, a lot of organizations have come to realization that clients feel comfortable with talking with people from their own culture, and that's why they're actively trying to hire people from their cultures as well. Alona?
I will just give her as well the information about what her rights and also all these like avenues where she's in case of crisis or emergency, providing her with all the hotlines and also like especially the legal system websites and all the like with all the contacts, because the more contacts she have, the more she become empowered and the more she feels secured. And also, if it's possible, collaborating as well with different agencies. It might be with charitable or with the government, and from there to help her as well and navigate of the process that she's going to do if she decide.
Definitely, yeah. Providing resources and support is a great way of building trust and also creating a safe space, definitely. Karen?
I was just going to bring up in this situation, what about the requirement of mandatory reporting where there's domestic violence in the presence of children? Because you've got to immediately break that promise that you're not going to say anything.
I think mandatory reporting is more related to people under 18.
No, in New South Wales, you're required to mandatory report if domestic violence has occurred in the presence of any children in the house.
So when it comes to domestic violence, it's a tricky one because a lot of the policies and procedures around confidentiality and all that sort of stuff,
they all go out the window.
They do. In some cases they don't. If there's no current domestic violence and there's fear of domestic violence, that's a tough one. What do you do in that situation? Do you call the police and the client didn't want you to call the police?
No. If there's fear and if the fear is
Yeah. But from your experience working with clients like this, you can see what's going to happen.
Yeah.
And you're like 99% sure that there is going to be further violence. But she's currently saying there is none, but I fear there might be, and I don't want you to call the police. So that's a very tricky one. Yeah, very, very tricky. I would say there would be a lot. Half the caseworkers would report it as mandatory reporters, like you said, and the other half would not to honor the contract that they verbally
had with
signed
the
with the client.
person in danger, but the equal danger of the two children and the unborn child.
Yeah.
Does that need to override the potential breach of trust that she's going to suffer when you then have to mandatory report?
Yeah.
Because you've only found this out after you've given her the whole spiel about how everything is purely confidential.
Yeah, I know what you're saying. If you, from what she's saying, if there's imminent danger to her and her kids, I would report it. But if she's saying that he's never hit the kids, he's hit me in the past, he hasn't hit me, but I feel like his anger's starting to get worse.
Has he ever hit you in front of the children?
Yeah, it's
Yes,
tricky one. Yeah, it's a
If
dilemma.
the answer is yes, then it's mandatory reporting immediately.
Yeah, it can
In New
be.
South Wales.
It can be, yes.
Children have witnessed it, it's
Yeah.
a mandatory reporting situation.
Yeah, it can be, yeah. It can be. But then if something doesn't happen and then the police come and then you make the situation worse, police leave, the wife the wife doesn't complain about it to the police, and when the police head home, and then what's going to happen then?
Yeah.
There's a lot of layers to this that you've got to be careful of as a caseworker. But you're right.
Yeah.
If you feel
I
like
think that's why in our position, wouldn't it be mandatory reporting to your supervisor? And then it's up to your supervisor to look at all those layers and work out the best thing to do.
Yeah. So your first point of action would be speaking to your supervisor or the lead caseworker or the lead support worker for the organization. And then from there, you guys will get all the information and facts in front of you and try to make the best decision possible. Yeah, it's a tough one. I'm not going to pretend to know pretend that I know there's no right answer to this. It's tough. Yeah. All right.
Yes.
Thank you for that tricky one, Karen.
Sorry for throwing that one in.
No,
you can tell that comes from 9 years in the courts dealing with a lot of domestic violence cases. So.
Yeah. I have that dilemma every single day with my job too. It's a tough one. It's just I guess it comes from experience, like yourself, experience, and I think you just got to learn the way to get the clients to understand their situation for what it is.
Yeah.
And to know that this is a serious situation and the police probably should be involved and try to get yourself out of that situation. But again, you got to let them make that decision, which is.
That's it.
Yeah.
These are the things that we can do for you. We can help you in this way, in this way, and this way.
Yeah.
And that's all you can really do at that point if there's not.
That's it.
Here's emergency housing if you need it. Here is this if you. An
That's
emergency
like
number.
Malone said, provide as much resources as you possibly can.
Yeah.
And try to make her feel trust that there's trust and that you feel safe, and then she can make that tough decision in getting herself and her kids out of that situation. Yeah. All right. So choice. So does anyone want to have a go at choice? All right. So choice. I would ensure that Ferriday understands that everything at first access is a choice for her, including whether she chooses to participate in the session, who she chooses to work with, and what she chooses to share. I will also seek to work with her to understand that choosing to share her difficulties might make it possible to work through them together. I will also transparently discuss the referral options and explain that any choices about referral are totally up to Ferriday. Let's go on to part C. I think you guys will be all right with empowerment in respect to diversity. Part C, research cultural appropriate services in your local area, which you could refer Ferriday to for the following: legal advice, emergency accommodation, social group activities. So you just got to look on the internet and find some things that are in your local area that would benefit her. So the responses will be different depending on the student, on your location and available services in that area that you live in. But responses must include legal organisation, one emergency accommodation provider for people experiencing domestic violence, and one cultural appropriate social activity group. All right, I'll give you guys a 5-minute break, and then when we come back, I'll play a video of a role play, just so you guys get a bit more understanding on what is expected in role play assessments. All right, I'll see you guys in at 8:15. Okay, so yeah, I'm just going to play a recording of a role play. So to give you guys understanding of what we expect, and yeah, for any questions in the end, I'll answer them. But this will be the end of our session after the role play recording. You guys can leave now if you wish and spend the time to do other things, or to start on your assessments, or just do whatever you want to, in other words. But if you're happy to stay back and watch the recording, that's fine as well. All right.
Is this a recording of like Hayter Institute doing it, or is it just someone else?
This is me and one of the students.
Oh man. Oh, cool.
Yeah. All good.
Hi there, my name is Cherie Hurd. I'm doing task 2 from unit CHCYTH015.
All right, guys. So as Cherry said, this is for unit CHCYTH015. Support young people to create opportunities in their lives. So this role play is divided into 3 parts. You've got part A, part B, part C. Part A is the initial meeting between Rita and Jonah Franks, where they have the initial meeting and talk about get to know each other. And then part B is where they further look into the goals and the action plans and all that. And part C is then the follow-up meeting a few months later. So we're about to start part A now. So the scene is, I walk into Cherry's office, she welcomes me, have a seat, just normal conversation that you would with any other client, just get them comfortable. You've got to remember to talk about the confidentiality policy and procedures and all that sort of stuff as well. And yeah, we'll just go from there. You ready, Cherry?
Yeah.
All right. I'm just going to knock.
Hi, Rita, is it? Come in. Welcome.
Hi. Hey, my name is Rita. Yeah. Are you Cherry?
Yes.
Oh, sorry. Are you Jonah?
Sorry, yes, I'm Jonah. Thanks.
Yeah, Jonah.
I'm one of the youth workers here at First Access. Come in and have a seat.
All right. I'm just a bit nervous. Where do you want me to sit? Just anywhere?
Yeah, just have a seat on the lounge here if you're comfy there. If not, you can grab the chair in the corner And I can grab you a cup of coffee, or would you like a glass of water, love? Probably
Oh,
can't.
that'd be nice. I'll get it maybe later. Yeah, I'll get a glass of water.
All right.
Yeah.
How's your morning been?
Oh, it's been all right. I'm just stressing out a bit. Yeah, I've got a lot of things going on at the moment. I just don't know where to start from.
Okay. Do you feel comfortable sitting here with me?
Hey, Kayon, it stopped.
Let's stop. Oops.
If you're there, Kayon, it's not playing.
Hello.
Yeah, I think I'm gonna hop off now. I hope everyone has a good night.
Hi, Rita, is it? Come in. Welcome.
Hi. Hey, my name is Rita. Yeah. Are you Cherry?
Yes.
Oh, sorry. Are you Jonah?
Sorry, yes, I'm Jonah. Thanks.
Yeah, Jonah. Okay.
I'm one of the youth workers here at First Access. Come in and have a seat.
All right. I'm just a bit nervous. Where do you want me to sit? Just anywhere?
Yeah, just have a seat on the lounge here if you're comfy there. If not, you can grab the
Okay.
chair in the corner and I can grab you a cup of coffee, or would you like a glass of water, love? Probably
Oh,
can't.
that'd be nice. I'll get it maybe later. Yeah, I'll get a glass of water.
All right.
Yeah.
How's your morning been?
Oh, it's been all right. I'm just I'm just stressing out a bit. Yeah, I've got a lot of things going on at the moment. I just don't know where to start from.
Okay. Do you feel comfortable sitting here with me? I'd love to hear what's going on.
Yeah, I do. Someone told me to come and see you. So some lady I met in the street. They
Okay.
told me to come and speak to First Access, and they could help me out with my situation.
All right. Well, just first off, so you know, everything that you say to me is confidential and private. So I'm not going to share it with anyone. It's not going to get anywhere. Anything I write, no one can see. The only reason it would is if, you know, there was going to potentially, I could see that there may be harm to you. So otherwise, everything's going to be confidential between you. So I hope you feel a bit more secure and safe about when we chat.
Yeah, all right. Okay, thanks for that. Yeah.
If you don't feel, if you don't want to open up to anything, that's fine. We can just chat about how your day's been and what it's like. I've heard that you've just come to Australia.
Yeah, I just came here with my family. We came from Vietnam.
Okay.
So yeah, my family came here obviously for more options and new opportunities. But yeah, I'm just struggling, you know, like I want to improve my English. As you can tell, it's not very good, and I want to be able to communicate more effectively with you know, people are, you know, in school and all that. Yeah, so at the moment I'm going to a place called St. Brennan State College, and
Okay.
yeah, I really want to get my school on track because I want to pursue a career in healthcare.
Wow, you know already what you want out of life. That's amazing.
Yeah. Yeah, I just need a bit of help around my English and all that. Yeah.
So it seems like, you know, you've already got some goals, and even with you struggling with English, you are committed, or you want to really try and get ahead with your English to get ahead with your goals in that you've created for yourself. So we could look at maybe even looking at doing some English classes first off. Do you think that would help? And you'd meet some other people if we could find somewhere for you to go.
I can, but that sounds good. But I just like I'm really shy, and like my confidence at the moment is really low as well.
Yes.
Yeah.
What about if we looked at something where you could actually start with it online? So maybe just an online, you and the phone, or you and the device, and maybe you could just do an hour here and there of some English before you could then, using that, if we find the right resources, maybe that would join into a group later that you could meet people online, but initially just you and the phone, or you and the device.
That sounds really good. Yeah, that might help.
All right, well, we can write that down and have a look. I can have a look at what we can find for you in that.
Awesome.
And so have you met anyone here? Any friends yet? Or
no, other than my school friends, that I haven't got any friends at the moment, but and my teacher and all that, but I haven't met any friends at the moment, no.
what about, do you have any interests that you like doing in Vietnam? Were you involved with any sports or groups?
I was involved. I was very good at school. I had high grades and all that. I was involved in the community. Well, my family's really religious as well, so we used to go to church a lot. Every Sunday we used to go. Yeah.
Has your family found a church?
They have, but I just don't feel comfortable in going because everyone there, I know they're Vietnamese and all that, but they all speak English. You know, I can't really relate to them that well.
Okay.
I don't know. Yeah.
Maybe when you feel a bit more confident with learning your English, you've got that confidence to then ask the church. Maybe there's some youth groups that they have, or other smaller groups where you could just, or one-on-one, they might introduce you to one person to connect with. But I know you're not feeling up for that yet, but even the fact that you're going.
Is there any like younger groups I can try to get connected with? I don't know if you can help me with that. Is there
Yeah.
like community groups with younger people?
Yeah, maybe if we find some, if we write that down as a goal, and we'll find a resource for you to connect with other.
Okay.
Would you want to meet other Vietnamese groups, or?
I don't mind, just people who are looking for friends as well, and
Yeah.
I can connect with them. Yeah.
Awesome. All right, we'll write that
Yeah.
down. I'll definitely look into that for you, and we can work together for some of those
Yeah.
goals.
Yeah, I just want to get involved and as much as I can with the community and all that.
Yeah. And you could even, if as you grow your confidence, we could find you some, this is down the track, but just keep in mind, if you wanted to, we could find maybe some volunteering for you to get into the health that you want to be helping people.
Yeah.
So there's some groups where, even though your English isn't that good, you could follow a volunteer maybe, and that might boost your confidence as well. And help.
Okay. Yeah, I just don't know what I'm going to do because my English is really poor. Like,
Yeah.
I don't know how I'm going to understand people, like, especially in the community groups or things like that.
So what we could do, I mean, you're doing great at the moment. Like, I can understand you really well. You've obviously learnt a lot, and you can progress on that with the apps and the resources that we find. And then maybe in these community groups, before you go, I could make sure for you that there's a interpreter or some other Vietnamese. Yeah. And we could link you up so you're not left behind.
Another word. Yeah.
Yeah.
Okay, that's great. I was thinking about that. I just didn't know what the word for interpreter, that's all.
Okay, so you've learned a new one already.
Yeah, all right. That sounds good, interpreter. And so I mentioned, so like I'm feeling isolated, and it's also, I think my anxiety and all that. I'm starting to get a bit of anxiety, and I don't know what to do. I've got all these emotions and feelings. I just don't know who to speak to, what to do with it. It's just, yeah, that's a struggle as well.
Okay, we obviously always welcome to come here, and we can talk whenever you need to. And if I'm not available, I'll find you someone else at First Access to help you. And we can also look at getting you some, whether you want a counsellor or we could find a doctor to talk to. We can get some more specialists involved. We could come up with a list of resources and then go through them. I'll go through them with you of who seems more appropriate. And again, making sure that there is an interpreter to go with you as well.
Okay.
Make you feel comfortable.
That sounds good. Yeah, I would really like to see a counsellor. Yeah.
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 Do you want to head out for some fresh air for a minute, or are you doing okay sitting there?
Yeah, actually, I would. Yeah, just have a little bit of a break. That'd be great.
Yeah, awesome. Well, outside you can sit under the tree there, and I'll bring you a cuppa, and then we'll chat in a few more minutes. Okay.
No worries. Thank you.
Thanks, Rita.
Guys, that was the end of that recording. Thank you for joining the session. I see that most of you have left. Apologize for that that pause. I think we've got thunderstorms here at the moment, so I think you played around with the internet. Apologies for that. I'm just going to end the recording now. I'll see you guys next week.
Thanks, mate.
All good.